In this video, we're going to demonstrate muscle testing for the shoulder region, focusing on the rotator cuff, deltoids, pectorals, and lat muscles. We're going to start with the supraspinatus, which is one of the rotator cuff muscles. First of all, we're going to bring the client's arm into a position where the wrist is at 90 degrees of the elbow. Now, in muscle testing, we'll normally test the good side first to find out what the client's normal strength is, and then we will compare that to the injured side. So we would be doing these alternative tests on both sides of the body, directly comparing one side to the opposing side. So we're testing supraspinatus on this side first, and what we want the client to do is literally to abduct at the elbow. But just so there's not too much movement around the upper body, I'm going to support onto the opposite shoulder, and I want to make sure that it should just be a matching of your pressure, but quite often clients might go into their maximal strength. So I'm just going to tuck my elbow into the side of my body, place the hand onto the side of the elbow, and then ask the client to push up into my elbow. We're going to hold it there for about 3 seconds, performing about a isometric contraction, just to see whether the client can hold that strength for a short period of time. Excellent, and relax. And then we would compare that directly to the other side. So from here again, Lydia is going to bring her wrist up in line with the shoulder. I'm going to support onto the opposite shoulder, press to the outside of the elbow, and the client is lifting into my hand, holding that for about 3 seconds just to match my pressure. Excellent, thank you. So for all of the tests that we're doing here, we would test good to bad. The next test that we're going to do is the infraspinatus, and that sits just below the spine of scapula on the back of the scapula. Okay, in this position, again, we're going to start from the same start position. So the wrist is in line with the elbow. I'm going to make sure that the elbow stays tucked into the side of the body. And in this movement, the client is going to do an external or a lateral rotation of the humerus. So again, I'm going to support onto the opposite side. I'm going to hold the client's forearm just above the wrist here, and then she's going to rotate into my hand. Again, just matching my pressure there. Again, just to demonstrate that good to bad, we would then do that on the other side. So wrist up in line, elbow at 90 degrees, holding just above the wrist. And again, the client is going to externally rotate at the humerus, holding or pushing into my hand. And they're just matching the pressure. Okay, so that was infraspinatus. So we've demonstrated a supraspinatus and infraspinatus. Then from here, we're going to go into subscap, which sits just below or just on the inside of the scapular bone. This is very similar, again, the same start position. And now in this instance, instead of externally rotating, the client is going to internally rotate. So again, it's a rotation at the humerus, at the shoulder joint. Okay, so we're going to, again, support on the opposite shoulder. This time I'm taking my hand just inside the forearm. And this time the client is going to push into my hand. Okay. Now, sometimes the client might start to try to cheat with their movement, and the elbow might come away from the side of the body. So in that instance, instead of supporting here, what we can do is place the hand here, then bring your other hand to here just to stop any cheat movement, and pulling inward or trying to internally rotate. So again, it's just matching your pressure for about 3 seconds. And then finally, the final of the rotator cuff muscles is the Terce Minor. So in this test, it's a double movement. The client is trying to abduct at the elbow and also rotate the humerus at the same time. Okay, so what we want to do, again, same start position here. This time we're going to take one hand just on the inside of the elbow there, and the client is going to push their elbow into your hand. Okay, at the same time, we're going to externally rotate the hand out to the side. So in this instance, we're going to place the hand here. So that we're going to ask the client to squeeze their elbow into your hand at the side, and at the same time, push their forearm out into your hand. Again, just matching that pressure. That can be tricky for some clients to do. So in that instance, if they're getting confused trying to do that double movement, what we can do is do it in 2 stages. Take the hand on the inside there, ask them to squeeze first, and then after that, then they're going to externally rotate at the shoulder. Excellent. So just to recap there, we've done supraspinatus, infraspinatus, subscapularis and Terce Minor. So that's our muscle testing for the rotator cuff muscles. We're then going to move on to the deltoids, and with the deltoids we've got the anterior head, we've got the lateral head and the posterior head. So we're going to do 3 movements here. Okay, so in this instance what we're going to do is we're going to elevate the elbow. Okay, so the elbow is up roughly at about 90 degrees. Okay. So we're going to test the anterior head first. The way that we're going to do that is placing your hand just on that bicep area. We're going to ask the client to push forwards. Excellent. So sometimes again there might be a bit of rotation in the top of the body. So again you can support the client by placing your other hand on the other side of the body. So again, just to demonstrate, the client is going to push forward, matching your pressure, and we're just stressing or contracting these anterior fibers. Then from here we're going to come into the lateral fibers, and again we're going to place the hand just above the elbow there, and this time the client is going to push up into your hand, again holding that for about 3 seconds, performing that isometric contraction. And then we're going to change our hand position slightly, and now the client is going to push back into your hand. Just being aware, quite often sometimes when that happens, that the shoulder girdle might elevate slightly. So if you've noticed from here that the shoulder girdle came up slightly when you were doing that movement, then just do that movement again, but this time push the shoulder girdle down and then ask the client to push back. And then we're isolating those posterior fibers of the deltoid. So again, just to recap here, anterior fibers, we're going to push forward, and then the lateral fibers, we're going to push up, and those posterior fibers, we're going to push back. And at the whole time we're holding those for 3 seconds for that isometric contraction and noticing for any cheek movements that might be occurring. Again, as with the previous testing, we would test good to bad. So just to demonstrate what that would look like, anterior fibers, we're going to push forward here. Excellent. And then we would come over to the other side. Client would bring their arm up, and then from there, client is going to push forward. Excellent. Okay, and then from here we're going to move into the pectorals. We're going to do 2 pectoral tests just to isolate the clavicular fibers and the sternal fibers of the pectoral. So a similar start position, we're going to bring the elbow up, so at that 90-degree angle again. And this time we're going to rotate slightly the humerus for about a 45-degree angle. If you visualize or look in the room where you are, and it's usually where the ceiling meets the wall. So if you're in more of an open space, look for where the wall is, think about where those fingertips are. And then from here, again, you're going to hold just in front, and the client is going to push their arm slightly upwards in that almost Superman position, bringing those fingers towards that line of the ceiling and the wall. Okay, and then for the sternal fibers, we're going to lower that arm down. Again, this time still about 45 degrees, but aiming for where the wall meets the floor. And again, hand here, and then they're going to push forwards. Again, holding that pressure for about 3 seconds, just so you can see whether the muscle fatigues quite quickly or not. And then our final test is the Latima Dorsi. So again, in this instance, back up, so the elbow is at 90 degrees. And then this time we're bringing the arm up in this position, and then we're going to hold just below the arm. Okay, now this can be a really strong muscle. So you're going to tuck the elbow into the side of the body, almost performing or providing a ledge here. And then the client is going to push down into your hand. Again, holding that contraction for about 3 seconds. And again, with this, as with all of those tests, we would then compare that good side to bad side. Hand up, tucking that elbow into the side of the body, holding just below the upper arm, and the client is pushing down. Excellent. Okay, and just to recap then, so that was our rotator cuff muscle tests. We also tested the three separate sections of the deltoid muscle, being the anterior deltoid, lateral deltoid, posterior deltoid, and then the clavicular and sternal fibers of the pectoral, along with the latimus dorsi of the back.